Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us again today. Psoriatic arthritis, or PSA, is a type of chronic inflammatory arthritis that occurs in some people who have had the skin condition known as psoriasis. Our guest in studio today is Dr. Jason Fowler. He's the chief of the arthritis clinic at Mount Sinai West Hospital. He's also on the staff of Beth Israel and Lenox Hills Hospitals. Been in private practice in New York City since 1982, and he's here today to talk with us about PSA and in an effort to raise awareness and get the word out so that support for research and funding for treatments can just take off and skyrocket. How are you doing today, Dr. Jason Fowler?
I'm doing very well. Thank you for having me.
Thank you. Psoriatic arthritis. You are spearheading an initiative on behalf of Celgene Corporation, the initiative called Be Counted. Could you talk a little bit about Be Counted?
Absolutely. So there are many individuals who suffer from arthritis, and some of those individuals may have psoriatic arthritis and not be aware of it. And we want those individuals to become educated so that they can pursue their proper diagnosis and treatment. And that campaign is called Be Counted. And we are hoping that the word will get out that individuals should potentially see a rheumatologist who is a physician who specializes in the treatment of arthritis so that they can be evaluated and those with psoriatic arthritis receive proper treatment. And I'm going to give you the website for that campaign. That website is psacounts.com.
How does the person who's suffering know? I mean, many don't know they have it, but what should someone look for as opposed to just regular arthritis?
In psoriatic arthritis, often the involvement is asymmetric, meaning it can involve one side of the body and not another. It may start in the feet. We have an entity called plantar fasciitis that many individuals may have seen a podiatrist for, or an orthopedist, or they may have heel pain or tendinitis in their Achilles tendon. And those are all locations where psoriatic arthritis may come into play, as well as having arthritis in the end joints of the fingers or toes, or a finger or toe that just stays swollen or has been swollen recurrently and not diagnosed. So those are possible ways that psoriatic arthritis may present. And those individuals, if any of that rings a bell, may have psoriatic arthritis and should see a rheumatologist.
There are a lot of us who suffer from arthritis in one form or another. Talk about some of the misunderstandings about arthritis in general and about psoriatic arthritis specifically.
Often all types of arthritis are lumped together, and individuals think that everything is just osteoarthritis, which is the wear and tear type of arthritis that one gets when one has worn out a joint or injured a joint, and the joint had cartilage injury and then wore down over time. There are some genetic types of osteoarthritis in the hands, but not all arthritis is osteoarthritis. Some arthritis, as you know, is rheumatoid, and some arthritis is, as we're speaking about today, psoriatic arthritis. And it is important to distinguish those various types of arthritis because there are different approaches to them. The key to diagnosing psoriatic arthritis is the presence of the skin disorder psoriasis.
And how often is that misdiagnosed? I mean, that's something very easy to diagnose.
I can tell you time and time again when I see patients who are being referred here by other physicians and other practitioners that walk into my office, they have arthritis and have never put two and two together that the scaling on their head, the dandruff that they've had, may represent a condition called psoriasis, that the rough elbows that they have aren't just rough elbows, that they're a skin condition called psoriasis.
And they're coming in thinking that they have something else, or not knowing.
They're coming in thinking that their joints hurt and they're not getting better, and they want to try to find out how to make them better.
the balms, the rubs, the normal arthritis treatments, once they take effect, are they as effective on psoriatic arthritis, for that short-term relief as just like
sometimes they are effective, but often the patients I see have already been to a general doctor, a foot doctor, an orthopedic surgeon, and they've tried a number of treatments, and the problem is that they aren't getting better.
Does this disease mimic any others? Is that why, they've taken so long to get some relief or at least get an answer?
Absolutely. There are patients who have, as I said, run-of-the-mill osteoarthritis. There are patients who have inflammation in their Achilles tendon or in their plantar fascia on the bottom of their foot that don't have psoriatic arthritis. So it does get confused from that standpoint. And many times patients with psoriatic arthritis will actually show up at orthopedic surgery having a knee replacement or a hip replacement, and it's gone that far, and they've never been diagnosed.
Ooh, that is severe. Do you think that it is more important that people who are sufferers and discover from their physicians who become educated, is it sort of a hand-in-hand healthcare provider and patient going out there and getting the word out, or should physicians band together and use their power to get the word out even faster?
Well, I would say that there are astute physicians who realize that this is a rheumatologic problem and make the referrals, but there are many patients who are suffering who have not been diagnosed, and unfortunately not all physicians make the referral to a rheumatologist or realize that the patient may have psoriatic arthritis, and those are the physicians we want to inform, and we are hoping that both through directly contacting those physicians as well as through perhaps our patients bringing up to their physicians the question of, could this be psoriasis on my elbow, and could my pain be psoriatic arthritis, that they will then get the proper attention.
Do you see maybe a resistance to looking into psoriatic arthritis because it's maybe a new thing? You're trying to raise awareness. So this is something that isn't as widely known as the other arthritic conditions. Do you see any resistance? I guess anyone wanting to do even further research before they even consider it. Maybe that is one of the reasons that the condition goes so long without being detected.
I think that psoriatic arthritis has so many faces. We talked about the foot, we talked about the end joints of the hands, but even low back pain, which can be chronic, can represent psoriatic arthritis. So it's just the awareness that so many different types of symptomatology can come under this umbrella that makes it so difficult to be recognized. And that's why we want everyone to be educated, to be counted, and we want them to go to the website psacounts.com.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today with Dr. Jason Fowler, Chief of the Arthritis Clinic at Mount Sinai West Hospital, also on the staff of Beth Israel and Lenox Hills Hospital. And we've been here talking about PSA, or psoriatic arthritis, some of the misunderstandings and misconceptions of this painful chronic condition. And I'm hoping that Dr. Jason Fowler will come back and talk with us in future segments.
I will be happy to.
Thank you very much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.